focused on Sporothrix schenckii, including clinical features, differential diagnosis, and treatment, with full rationale for the correct and incorrect options. Question 1. Clinical scenario. A 42-year-old woman who works as a florist presents with a painless ulcerated lesion on her right hand and several nodules extending proximally along the arm. She recalls pricking her hand on a rose thorn 1 week ago. Which of the following is the most likely causative organism? A. Sporothrix schenckii, B. Mycobacterium lepra, C. Bacillus anthracis, D. Nocardia asteroides, E. Candida albicans. Correct answer, A. Sporothrix schenckii. Explanation: this is classic sporotrichosis, rose gardener's disease, caused by Sporothrix schenckii, a dimorphic fungus. Entry via trauma from vegetation, e.g. thorns. Lesion spreads via lymphatics, ascending lymphangitis with nodular lesions. Why not the others? B. Mycobacterium lepra causes chronic, non-ulcerative skin lesions and peripheral neuropathy. No lymphatic spread pattern. C. Bacillus anthracis, cutaneous anthrax, causes painless black eschar, not lymphangitic spread. D. Nocardia asteroides, causes skin infections after trauma, but in immunocompromised, often purulent, and may involve CNS. E. Candida albicans, causes superficial infections, thrush, vaginitis, not nodular lymphangitic spread. Question 2. Microbiology identification. Which of the following best describes the appearance of Sporothrix schenckii in infected tissue? A. Spherule filled with endospores. B. Cigar-shaped yeast. C. Encapsulated yeast with narrow budding. D. Broad-based budding yeast. E. Septate hyphae with acute angle branching. Correct answer B. Cigar-shaped yeast. Explanation: in human tissue at 37 degrees Celsius, Sporothrix schenckii appears as cigar-shaped yeast. In the environment, it forms mold with hyphae and conidia. Why not the others? A. Spherule filled with endospores, Coccidioides immitis. C. Encapsulated yeast with narrow budding, Cryptococcus neoformans. D. Broad-based budding yeast, Blastomyces dermatitis. E. Septate hyphae with acute angle branching, Aspergillus species. Question 3. Treatment. A 38-year-old gardener is diagnosed with lymphocutaneous sporotrichosis after presenting with cutaneous ulcer and nodular lymphangitis. Which of the following is the most appropriate treatment for this condition? A. Amphotericin B, B. Fluconazole, C. TMP-SMX, itraconazole, E. Nystatin. D. Itraconazole. Explanation: itraconazole is the first-line treatment for cutaneous or lymphocutaneous sporotrichosis. Potassium iodide, oral, is an alternative, especially in resource-limited settings. Why not the others? A. Amphotericin B, reserved for severe or disseminated disease. B. Fluconazole, less effective for Sporothrix. C. TMP-SMX, used for nocardia and pneumocystis, not Sporothrix. E. Nystatin, for superficial candida, not systemic or subcutaneous fungi.